Welcome to our deep dive into the National Family Health Survey, or NFHS, like everybody calls it. We've got these excerpts you sent over from the Fifth National Report, and then there's this policy analysis from PRS Legislative Research. Really fascinating stuff. It's almost like we're giving the entire country a health checkup.
I like that analogy. It really is a treasure trove of information. The NFHS gives us this incredibly detailed view of how India is doing in areas like family planning, maternal health, even things like nutrition and women's empowerment.
And the best part is we have 2 rounds of data to compare. The 4th one from back in 2015-16, and the 5th from 2019 to 2021. So we can really see what's changed, and whether it's for the better or worse.
Exactly. It's like having a before and after picture. It helps us understand the real impact of all sorts of policies and programs.
Okay, well, let's dive into the numbers then, shall we? The first one that really jumped out at me was about India's total fertility rate, the TFR.
Oh, yeah, the TFR. That's the average number of children a woman is expected to have over her lifetime. And in the NFHS-5, it's dropped down to 2.0, which is a pretty significant decrease from the last survey.
So a TFR of 2.0. Does that mean India's population is on the verge of shrinking?
Not necessarily. It means India is getting closer to what we call the replacement level, which is 2.1 children per woman. Basically, it's the number needed for a population to replace itself, keep things stable. Now, India still has 5 states that are above that replacement level, but overall the trend is pretty clear. We're moving towards population stabilization.
That's a huge shift. What do you think is driving this decline in the TFR?
Well, the report points to a big increase in the use of family planning methods. All across India, like in Goa, for example, there's been a massive jump, a whole 42 percentage points increase in the use of family planning between the 2 surveys. And even Bihar saw a significant increase, 32 percentage points.
Wow, those are some really impressive numbers. It shows how these family planning programs can actually empower people, to make their own choices about their families. And then that contributes to these broader demographic trends. But there was one finding that I found a bit concerning. The sex ratio at birth has actually declined in several states.
Yeah, that's definitely a worrying trend. Like Goa, for instance. They went from having 966 females for every 1,000 males in the NFHS-4 down to just 838 in the NFHS-5.
Wow, that's a pretty steep drop. What could be causing that?
Well, there are probably a lot of factors at play. I think cultural preferences for male children are definitely a part of it. And then, unfortunately, the misuse of technology for sex determination before birth, it's still a problem. This trend just shows how important it is to address not just policies, but also those deep-seated societal norms we were talking about earlier.
You're right. It's a good reminder that true gender balance, it requires a multifaceted approach. Speaking of gender, let's shift gears a bit and talk about maternal and child health. I was happy to see that institutional births have increased significantly.
Oh yeah, me too. Institutional births are so important because they give mothers access to skilled medical care during delivery, which drastically reduces the risks for both the mother and the newborn. Nationally, institutional births have increased to almost 89%, and even in rural areas, it's reached 87%.
That's fantastic. Were there any specific states that really stood out?
Yeah, Arunachal Pradesh saw a remarkable increase in institutional births. Between the 2 surveys, a whole 27 percentage point jump. And then West Bengal, they managed to increase institutional births while also reducing the out-of-pocket expenses for those deliveries.
So basically they made it both more accessible and more affordable. That's amazing. Now what about the infant mortality rate, the IMR?
Well, there's good news there too. The IMR has gone down in most states. Assam, for example. They saw a big decrease from 48 to 32 deaths for every 1,000 live births. It's a good sign that efforts to improve child health are really working.
It is incredible to see how far we've come. But I have a feeling there are still challenges in this area.
You're absolutely right. Despite all this progress, child malnutrition, especially stunting and wasting, it's still a big problem in India. Even though we've seen some reductions, over 35% of children under the age of 5 are still stunted.
And we know that stunting, it doesn't just affect their physical growth.
Right.
It can have long-term consequences for their cognitive development and their well-being overall. It really impacts their entire future.
Exactly. And here's another challenge that the NFHS-5 highlights, the rise in obesity in some states like Kerala, Andhra Pradesh, and Goa. More than a third of adults are now either overweight or obese.
That's surprising. I wouldn't have expected obesity to be increasing in a country that's still struggling with malnutrition.
Well, it's a complex issue. It really reflects the changing dynamics of health and lifestyle in India. We're seeing shifts in dietary habits, increased access to processed foods, and less physical activity overall. It all points to the need for a more holistic approach to public health, one that addresses both undernutrition and overnutrition.
Yeah, it is. It's kind of like this paradox, right? We see all this amazing progress in some areas of health and well-being, but at the same time, we're facing these brand new challenges like the rise of obesity.
Mm.
It really highlights the complex reality of public health, especially in a rapidly developing country like India.
It definitely does. You realize that progress isn't always a straight line. So speaking of development, I'm curious to see what the NFHS data tells us about access to essential infrastructure. Like, what kind of picture does it paint?
Well, it's kind of a mixed bag, to be honest. On the one hand,
Mm.
we see huge improvements in access to things like electricity, clean drinking water, sanitation facilities all across India.
Oh, wow.
Yeah.
That's really encouraging. What do you think is driving this change? Well, government initiatives like the Swachh Ferret mission have definitely played a key role. It's that nationwide sanitation campaign that was launched back in 2014. Remember, it was aimed at getting rid of open defecation and improving hygiene practices. And it looks like it's actually having a real impact.
That's a great example of how these targeted policies can lead to real improvements in people's lives. But you said it was a mixed bag, right? What's the not so good news?
Well, even though access to basic infrastructure is getting better, there are still these significant gaps in digital access, especially when it comes to internet usage. Women are lagging way behind men. This is especially true in states like Andhra Pradesh, Bihar, and Tripura.
That's definitely concerning. We hear so much about the digital divide these days, and this data just emphasizes why it's so important. If women don't have the same access to the internet, they're going to miss out on all sorts of opportunities: education, employment, even just accessing information about health and their rights.
Exactly. It goes way beyond just having a smartphone. It's about having the skills and opportunities to actually use technology to empower yourself. And unfortunately, the NFHS data shows that we still have a long way to go on that front.
For sure. It's definitely something to keep in mind. There was one finding in the report that I found really interesting, and maybe a bit puzzling. It was about women's financial inclusion.
Oh, you mean how the proportion of women with bank accounts has gone way up?
Yeah.
But at the same time, there's been a decrease in women owning land or houses in some states.
Oh, yeah, that's exactly what I'm talking about.
Yeah.
It's so strange. More women are part of the formal financial system now, which is a good thing. But they're losing ground when it comes to owning assets. It just doesn't make sense.
It does raise some questions, doesn't it? Like, is having access to a bank account really translating into real economic power for women? Do they have control over their finances? Or are they just using those accounts to pay for household expenses? The NFHS data makes us think beyond those simple metrics and really consider what's going on in women's economic lives.
It definitely does. We need to see the whole picture, not just isolated data points. We can't talk about women's well-being without discussing gender dynamics and empowerment in general. What insights does the NFHS give us on that front?
There's some good news here. Actually, the use of hygienic methods during menstruation has increased all across India. Although there are still disparities, states like Bihar and Assam are still lagging behind, though.
Why is that so significant?
Because menstrual hygiene isn't just about personal comfort. It's a public health issue. If girls and women don't have the right sanitation facilities and menstrual products, they can get infections and other health problems. It can even affect their education and their ability to participate in daily life.
You're right. It's one of those things we take for granted. But for a lot of women, it's a huge barrier, along with that positive trend. There was one statistic that really stood out, not in a good way, though. The NFHS-5 shows that spousal violence has actually gone up in a few states. Like in Karnataka, it doubled.
It's a stark reminder that progress isn't always linear. To deal with deep-rooted problems like domestic violence, we need more than just laws on paper. We have to change social norms, provide support for survivors, create a culture where violence against women is just unacceptable.
A tough conversation to have, but a really important one. It makes you appreciate just how broad the NFHS really is. It captures both the amazing progress that's being made and the struggles that are still going on in Indian society.
I agree. The data is powerful. It can help us shine a light on the areas where we need to step up. Before we wrap up our look at the current NFHS, let's talk a little bit about the future. The Ministry of Health is already working on the next round, NFHS-6. It's planned for 2023-24. I bet you're wondering what new areas they're going to be exploring.
You know me too well. What can we expect from the next survey?
Well, NFHS-6 is going to cover some new areas, things that reflect how the health and social landscape of India is changing. They'll be looking at the impact of COVID-19 digital literacy and even menstrual hygiene practices, which we just talked about.
That makes a lot of sense. Those are all really important parts of well-being today. It'll be interesting to see what the data shows us. I imagine the information from NFHS-6 will be really important for developing policies and programs in the coming years.
Definitely. Each new round of the NFHS, it's like adding a new chapter to the story of India's development. And when we analyze these trends, we can get a better understanding of where we've been, where we are now, and where we still need to go.
It's amazing when you think about it. The scale of this survey is massive. They're interviewing hundreds of thousands of people all over the country, gathering data on so many topics. It's almost like we're listening in on the heartbeat of the whole nation.
I know, right? That's exactly what makes it so powerful for understanding these complex issues. Health, well-being, social progress in India. It's all there in the data.
We've covered a lot of ground in this deep dive. The declining fertility rates, the challenges of malnutrition, that whole digital gender gap we talked about. But as we wrap up, I keep thinking about this idea of the NFHS as like a roadmap.
I like that. A roadmap. Yeah. It's more than just a snapshot of where we are right now. It's like a guide that helps us figure out how to move forward, how to get to a healthier, more equitable future for everyone in India.
Exactly. So how can we use this roadmap effectively? What are the key takeaways, you think? What should we be focusing on?
Well, one thing that stands out to me is the importance of nuance. We've seen how progress in one area, it doesn't always mean that things are getting better everywhere else. Sometimes it can even hide problems that are getting worse.
Like that example we were discussing earlier, about how more women have bank accounts now, but fewer of them are owning land or houses. It's a strange contrast.
Exactly. It reminds us that we need to look beyond those simple success stories and really pay attention to the areas where we're falling short. We have to understand how all these issues are connected and how they affect people's lives in all these different ways.
The NFHS-5 also shows us just how important context is. What works in one state might not work in another. India is so diverse. Different cultures, different socioeconomic situations, even geography plays a role.
Yeah, absolutely. We can't just apply the same solutions everywhere. A one-size-fits-all approach just won't work. We need specific solutions that take into account the unique needs and challenges of each region. And that's where the NFHS really shines. It gives us that detailed data that we need to actually develop targeted interventions.
It's like having a super detailed map, not just of the highways, but all those smaller roads and paths that lead to individual communities.
That's a great way to put it. We can use this map to find the most effective route to get to a healthier, more equitable future for everyone in India.
And with the next NFHS coming up, NFHS-6, we'll have even more detailed information to work with, especially now that they're going to be looking at the impact of COVID-19 and digital literacy.
Yeah, the pandemic has obviously had a huge impact on health and well-being all over the world. So understanding those long-term consequences in India, it's going to be crucial for figuring out the right public health strategies moving forward.
And like we talked about before, digital literacy is becoming so essential in the world today. The data from NFHS-6 will help us figure out how to close that digital divide and make sure everyone has a chance to succeed in this digital age we live in.
It all comes down to connecting the dots, seeing how these different factors interact and influence each other. That's what makes this work so exciting, We're not just sitting back and watching these trends unfold. We're actually helping to shape the future.
And that's where our listeners come in. We've shared some of the key insights from the NFHS, but there's so much more to explore in these reports. I really encourage everyone to check them out. Dig into the areas that interest you, and think critically about what all this data means for the future of India.
Ask yourself some questions. How do you think technology and these changing social norms are going to affect the things we've talked about today? What new challenges and opportunities are coming our way? How can we use data and innovation to create a better future for the generations to come?
Those are some big questions. We should all be thinking about them. It's important to remember that creating a healthier, more equitable India, it's something we have to do together. Every voice, every perspective matters in this.
Thanks for joining us on this deep dive into the NFHS. Remember, stay curious, keep exploring, and let's use this data to actually build a better tomorrow.
That's right. From all of us here at the Deep Dive, until next time, keep learning.